Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without the way, let's get started.
A client diagnosed with undifferentiated schizophrenia is being discharged on aripiprazole 5 milligrams every night. When developing the teaching plan about the most common adverse effects, which of the following should the nurse include? Select all that apply. 1. Headaches that will subside in a few weeks. 2. Transient mild anxiety. 3. Insomnia. 4. Torticollis. 5. Pill rolling movements. The correct answers are 1, 2, and 3. Headaches, transient anxiety, and insomnia are the most common adverse effects of aripiprazole. Torticollis and pill rolling are more common with the older antipsychotics. A client with undifferentiated schizophrenia tells a nurse that he doesn't go out much because he doesn't have anywhere to go and he doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? 1. Encouraging him to call his family, to visit more often. 2. Making an appointment for the client to see the nurse daily for 2 weeks. 3. Thinking about the need for rehospitalization for the client. 4. Arranging for the client to attend day treatment at the clinic. The correct answer is 4. Because the client can live in an apartment setting, further development of independent functioning and the skills to gain as much independence as he is capable of need to be fostered, including getting out and developing new friendships. Arranging for participation in day treatment is most beneficial at this time. Family visits and daily nursing visits do not encourage the client to do this. Making an appointment for 2 weeks later puts the client's needs off. Lack of social relationships is not a sufficient reason for rehospitalization. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait. Asking another staff member to stay with the client, or saying nothing is not helpful. A client with schizophrenia comes to the outpatient mental health clinic 5 days after being discharged from the hospital. The client was given a 1-week supply of clozapine. The client tells the nurse that she has too much saliva and frequently needs to spit. The nurse interprets the client's statement as indicating which of the following? 1. Delusion, requiring further assessment. 2. Unusual reaction to clozapine. 3. Expected adverse effect of clozapine. 4. Unresolved symptom of schizophrenia. The correct answer is 3. Sialorrhea, excessive salivation, is commonly associated with clozapine therapy. The client can use a washcloth to wipe the saliva instead of spitting. It is an expected adverse effect of the drug, not a delusion, an unusual reaction, or an unresolved symptom of schizophrenia. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which of the following? 1. Apathy, affect social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. A client with pregnancy-induced hypertension is to receive magnesium sulfate to run at 3 grams per hour with normal saline to maintain the total IV rate at 125 milliliters per hour. The nurse giving end of shift report stated that the client's blood pressures have been elevated during the night. The oncoming nurse checked the client and found magnesium sulfate running at 2 grams per hour. Identify the nursing actions to be taken from first to last. 1. Notify the primary healthcare provider of the incident. 2. Assess the client's current status. 3. Correct the IV rates. 4. Initiate an incident report. The correct answer order is 3, 2, 1, and 4. The nurse should first change the IV magnesium sulfate and normal saline infusion rates, and then assess the current status of the client. The nurse should then notify the primary healthcare provider to explain the error and report the action taken. A medication error has occurred, and the nurse will need to initiate an incident report. Several pregnant clients are waiting to be seen in the triage area of the obstetrical unit. Which client should the nurse see first? 1. A client at 13 weeks gestation experiencing nausea and vomiting 3 times a day with +1 ketones in her urine. 2. A client at 37 weeks gestation who is an insulin-dependent diabetic and experiencing 3 to 4 fetal movements per day. 3. A client at 32 weeks gestation who has preeclampsia and +3 proteinuria who is returning for evaluation of epigastric pain. 4. A client at 17 weeks gestation who is not feeling fetal movement at this point in her pregnancy. The correct answer is 3. A preeclamptic client with +3 proteinuria and epigastric pain is at risk for seizing, which would jeopardize the mother and the fetus. Thus, this client would be the highest priority. The client at 13 weeks gestation with nausea and vomiting is a concern because the presence of ketones indicates that her body does not have glucose to break down. However, this situation is a lower priority than the preeclamptic client or the insulin-dependent diabetic. The insulin-dependent diabetic is a high priority. However, fetal movement indicates that the fetus is alive but may be ill. As few as 4 fetal movements in 12 hours can be considered normal. The client may need additional testing to further evaluate fetal well-being. The client who is at 17 weeks gestation may be too early in her pregnancy to experience fetal movement and would be the last person to be seen. A client at 4 weeks postpartum tells a nurse that she can't cope any longer and is overwhelmed by her newborn. The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. A woman who has given birth to a healthy neonate is being discharged. As part of discharge teaching, the nurse should instruct the client to observe vaginal discharge for a postpartum hemorrhage and notify the healthcare provider about 1. Bleeding that becomes lighter each day. 2. Clots the size of golf balls. 3. Saturating a pad in an hour. 4. Lochia that lasts longer than 1 week. The correct answer is 3. A postpartum client who saturates a pad in an hour or less at any time in the postpartum period is considered to be hemorrhaging. As the normal postpartum client heals, bleeding changes from red to pink to off-white. It also decreases in amount each day. Passing blood clots the size of a fist or larger is a reportable problem. Lochia varies in how long it lasts and is considered normal up to 6 weeks postpartum. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on the cord, enabling perfusion to the infant. Turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. The nurse notices that a client who has just given birth is short of breath, ashen in color, and begins to cough. She becomes limp on the birthing table. At last assessment half hour ago, her temperature was 98 degrees Fahrenheit, pulse 78 beats per minute, respiration 16 breaths per minute. Determine the nursing actions in the order they should occur. 1. Open airway using head, tilt, chin, lift. 2. Ask staff to activate emergency response system. 3. Establish unresponsiveness. 4. Give 2 breaths. 5. Begin compressions. The correct order is 3, 2, 5, 1, and 4. The client's actions indicate distress, and the nurse should initiate emergency procedures. The nurse should first establish unresponsiveness and then ask staff to activate the emergency response system. Next, the nurse should follow CABs of CPR. The nurse should check the pulse and begin CPR. Then after 30 compressions, the nurse should assure the open airway and give 2 breaths. After suction and evacuation of a complete hydatidiform mole, the 28-year-old multigravida client asks the nurse when she can become pregnant again. The nurse would advise the client not to become pregnant again for at least which of the following time spans? 1. 6 months. 2. 12 months. 3. 18 months. 4. 24 months. The correct answer is 2. A client who has experienced a molar pregnancy is at risk for development of choriocarcinoma and requires close monitoring of human chorionic gonadotropin levels. Pregnancy would interfere with monitoring these levels. High HCG titers are common for up to 7 weeks after the evacuation of the mole, but then these levels gradually begin to decline. Clients should have a pelvic examination and a blood test for HCG titers every month for 6 months, and then every 2 months for 1 year. Gradually declining HCG levels suggest no complications. Increasing levels are indicative of a malignancy and should be treated with methotrexate. If after 1 year the HCG levels are negative, the client is theoretically free of the risk of a malignancy developing and could plan another pregnancy.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.